Welcome to MEDx channel. Today we are going to talk about how to measure the blood pressure. Measuring hypertension accurately is crucial for managing your health effectively. Hypertension, or high blood pressure, often goes unnoticed until it leads to serious health issues. The process begins with understanding what blood pressure readings mean, which are represented with two numbers: systolic and diastolic pressure. Systolic pressure, the first number, measures the pressure in your arteries when your heart beats. Diastolic pressure, the second number, measures the pressure in your arteries when your heart rests between beats. To measure hypertension accurately, a reliable blood pressure monitor is necessary. You can choose between manual monitors, which utilize a stethoscope and cuff, or automatic digital monitors that are easy to use with one-button operation. Whichever device you choose, it is vital to ensure it is validated for accuracy. Before taking a reading, find a quiet environment. Sit comfortably in a chair with your back supported and feet flat on the floor, allowing at least 5 minutes of rest. This practice calms your body and prepares it for an accurate reading. Once in position, roll up your sleeve and wrap the blood pressure cuff snugly around your upper arm, above the elbow. Ensure the cuff is at heart level for the best results. For a digital monitor, simply press the start button. If you are using a manual device, slowly inflate the cuff by squeezing the bulb until you can no longer feel the pulse in your wrist. Then, gradually release the pressure while listening through the stethoscope, noting the readings when you hear the first heartbeat and when it disappears. This technique provides you both systolic and diastolic measurements. It's essential to take multiple readings over days or weeks to get a comprehensive understanding of your blood pressure levels. Keep a record of these readings so you can share them with your healthcare provider. Consistently high readings may require lifestyle changes or medical intervention. Factors such as stress, diet, and activity levels can fluctuate blood pressure, so ensuring you measure it in similar conditions helps build a clearer picture of your health trends. Regular monitoring empowers you to take control of your hypertension. It allows you to track the efficacy of lifestyle changes or medication, fostering a proactive approach to health management. Remember, hypertension often presents with no symptoms, making regular checkups and vigilant self-monitoring essential. By following these steps, you can measure your blood pressure effectively, shaping a better path toward a healthier life. Don't forget to like the video and subscribe the channel. Thanks for watching.